So I'm happy to introduce this segment, which is a new addition to the program this year. We didn't have this segment last year. So as mentioned, while we've been having our patient group discussions down here, the observers have been having their own discussions upstairs, facilitated by Jerry Jeffcott and Alex Kyriakos, who are sitting right here. And we're eager to hear their feedback on what those discussions were and how we can use that moving forward. So I'll hand it over to Jerry and Alex for a report back on the observer discussions.
Thank you, Sophie, for the introduction, and thank you to Louise and the organizing committee for asking 360 to be involved. It's been our pleasure to be part of this, and lots of insights for us as well as you, I'm sure. A little bit self-conscious about being the last speaker between you and getting home, but okay.
Oh.
Okay. So just to sort of provide a little bit of perspective on what we tried to achieve, there were a group of people who were at the meeting who were not patients or representing patient organizations, industry groups, government people from various agencies, etc., who have an interest. And so we brought that group together and had some conversations while you were having your sort of patient-oriented conversations. And what we did, our mandate was to ask the observers to think about, from their perspective, what advice or suggestions or observations they might make that would be helpful to patients to optimize their interventions into this debate. So we weren't looking at it in terms of what were the farm industry or what was the government going to do to fix it. We were going to ask, what did they think that they could offer to patients? So in order to contextualize that conversation, Alex and I developed some questions that we put to the group. So I'm just going to tell you what the questions were, and then we'll go through some of the observations and recommendations that came out of it. So we asked them, from a patient perspective, what do you think needs to change in the future to create a more accessible drug pricing system and more overall access to medications and biologics? What do you see as the patient role in the system? And how can patients be more meaningfully involved in the system? So those were sort of the overarching questions that we put to the group, and we got a very sort of robust conversation going. Unfortunately, there wasn't enough time. There never is enough time, as Louise and I were discussing last night. But we did get some insights. So there was, I think, part of the process of sort of coming up with recommendations was just sort of trying to develop sort of an understanding or an appreciation. So there was a lot of observations that came out, which may seem perhaps pedestrian. I don't know. They were just sort of people sort of expressing the point of view. So things like, there is a need to create a meaningful two-way dialogue between patients and public payers that goes beyond just the patients providing some input, but towards establishing a more communicative and collaborative relationship where there's an ongoing dialogue on these issues. There was an expression that patients need really more continuous education about what the private marketplace is doing and how it's impacting patient lives. There was a recognition that patients need to be involved in the creation, the design of the policies, rather than just their implementation. There was a sense that patients need to be involved in the governance and the decision-making around the system. So creating the process together, as opposed to sort of, here's the process, how do we interact with it? And there was one of the folks from industry said that industry should be contributing by ensuring that patients are invited to participate in all panels and podiums where there's a valid place for them to contribute. So that means that industry should be thinking about making invitations, providing financial support, and doing these sorts of things where patients would be in a position to provide and share their views and perspectives. So those were some of the sort of observational kinds of things that were said. I'm going to let Alex just run through some of the recommendations that came out of it.
Sure. So in terms of what we sort of discussed at these meetings, I think there was I think just to repeat Jerry here, there wasn't a lot of time, and just as we started going, and people had a lot of wonderful ideas based on their own experiences, which I think is really quite relevant. We try to focus on what were some of the actionable items that patient groups could take. So one of the recommendations was that patient groups should identify what success looks like for them and what kind of support they need and from whom to help them achieve it. They also need to figure out and present what value they can offer to each process they want to be involved in. Patient groups should establish disease condition registries and collect relevant data, actively participate and share that relevant data. I think there was an example brought up of the Fabry registry, which was implemented about 10 years ago, which has now become a sort of international gold standard. It has worked very well, so that was an example of a good model. Patient groups should take a bite-sized approach, because this is, as we've heard last couple of days, this is an overwhelming issue and an overwhelming mountain. Perhaps select a single jurisdiction or condition to focus on first. And one of the other things we heard, and I think it was a theme yesterday too, patient groups should share best practices and leverage those experiences with other patient groups, because as Louise mentioned, not all patient groups are created equal. Some patient groups have been very successful over the years, and I think the failure has been to actually leverage those successes, and for those patient groups who have been successful, to help those other patient groups who really need to kind of, experience that kind of success.
So, within, what is it, about 30 minutes altogether of conversation, that's what we were able to come up with. So I appreciate appreciate the opportunity to provide those insights on behalf of our group. Thanks so much.
Yep.
Say thank you to our two folks who manage the Observer team, because this is an in-kind donation from them, and that's really generous. I hope underneath it somebody else is thanking you in a different way, but we aren't, and so we really appreciate you. This is the second year you've offered, and of course we always accept, but it's nice of you to take time when you could be back home making money, and that's much appreciated. So thanks again.
Thank you again. We will, for the patients and caregivers who are in the room, don't leave, because we're going to be working together and just, getting ourselves organized for the coming year, revising our working committees, our work plan, etc. But certainly for the observers, this is the end part of the summit. So I wanted to invite Antonella Scali and Jackie Manthorn to offer a few words before we part ways.
Well, I'm going to thank Jerry and Alex again of 360 Public Affairs for their donation of time to facilitate the Observer breakout conversations over the 2 days and to report back to us. On a personal note, as the mom of a mentally ill daughter, I want to say how pleased I am that mental health issues are making their way onto the agenda, and I hope that this will grow over time. We have some different issues, obviously, because of the nature of the illnesses, but we also have much in common. Antonella and I want to take this brief opportunity to thank everyone again before our observer participants leave for the day so that patient and caregiver groups are able to continue to collaborate on next steps. My name is Jackie Manthorn, and I'm the President and CEO of the Canadian Cancer Survivor Network.
Hi, everyone. I'm Antonella. I'm the policy analyst with the Schizophrenia Society of Ontario, so thank you, Jackie. And we do want to just recap a little bit on what we said when we opened up the summit yesterday morning, which seems like a long time ago now. I'm sure to a lot of us, it's a long 2 days. But to recap, this year's summit had over 100 participants registered, representing 53 patient organizations from 6 provinces and 48 observers from other stakeholder groups. So we do want to acknowledge our generous sponsors again, starting with the Innovative Medicines Canada, who is our key Tier 1 sponsor, as well as Pfizer, Eli Lilly, Amgen, AstraZeneca, Novartis, Bristol Myers Squibb, Roche Canada, Janssen, GSK, and Merck. Because without their generous support, we wouldn't be here today, and we wouldn't be able to bring people in from across Canada and across different health organizations.
We also want to recognize again the relentless and long-term work of our Summit Steering Committee, Louise, Chad, Rose, Leah, and Sophie, who's managed to keep us on track, which is no easy feat. It's sort of like herding cats, I know. We want to acknowledge and thank Leah for her administrative support, Amanda for her program and communication support, and Joanne, our amazing note-taker, as well as Matthew and Wayne for presenting 2 introductory webinars. Thank you again to our small group facilitators, Ron, Rose, Leah, and Sylvia. Thanks also to the Japanese Canadian Cultural Center, Oak Park Delhi, for catering the event. I'm sure you'll agree with me that the food was tasty and also nutritious, no easy feat either. And thanks to our technicians, Red Tree Productions. Thank you to all of our panelists, and particularly our patient panel of Martine, Phil, and Linda. Your work was much appreciated.
And of course, we want to thank our working committees who over the past year since the last summit have been coming together and really keeping the momentum going, because these 2 days are really an opportunity to provide inspiration, information, and opportunities for collaboration. But the work continues, and we are very excited to be part of moving Canada toward a system based on value-based health outcomes measurement, which is truly person-centered and truly reflective of the needs of all of the different groups in this room. So this means ongoing partnership across all of the patient and caregiver groups here and those that aren't here today and who we know share a similar vision and similar aspirations, and new and renewed collaborations with our observer stakeholders as well. It's apparent how important that is, and even more so after this year's summit. So we really do look forward to working with everyone over the next year.
We know that you're here because this work matters to you too. Again, we hope that all of you here, patients, caregivers, and observer stakeholders, will join us, if you haven't already, by signing up to a working committee, by filling out your commitment form, writing your name and email on the list posted on the wall, or just letting one of us know. Yeah, and again, thank you. We look forward to working together over the next year and perhaps meeting same time, same place approximately next year. Thank you.